Hello guys, so today we shall be discussing another most important infection, that is Borrelia. Borrelia burgdorferi, right? That is our Borrelia burgdorferi, right? So what is this basically? This is a spirochete, right? So what is this basically? This is a spirochete. What do you mean by spirochetes? So spirochetes are those organisms which are spiral in shape, right? So those are called as spirochetes. So how is this basically transmitted, guys? What is the way transmission route of this? Yeah, how it is basically transmitted? It is transmitted, right, with the help of a specific tick called as Zod stick. With the help of a specific tick called as Zod stick. And if you ask me what are the basic risk factors, I told you when this Zod stick, when it will bite you, right, the tick bite leads to this infection, that is Borrelia burgdorferi, right? So what are the basic conditions that are associated with this? What are the associated conditions? The associated conditions, there are basically two. And what are these two conditions? One is it causes babesiosis, and the second one is it causes ehrlichiosis. Two things. One is it causes ehrlichiosis and the other one is causes babesiosis. What are the different stages? There are basically three different stages. One is called as the early stage. So what do you find in early stage? What are the manifestations which you find in early stage? In the early stage, you will find a specific type of rash, and that is called as erythema marginatum or erythema migrans. Erythema migrans. When you look at that rash, you will find a small bull eye appearance, right? So you will find a bull eye appearance. The second important thing, after the early stage, it is early disseminated stage. Early disseminated stage. So what was previous stage, guys? Previous stage was early generalized localized stage. Early localized stage, and this is called as early disseminated stage. Early disseminated stage, and previously was early localized stage. In early disseminated stage, what are the important thing which you find? You will find multiple erythema migrans. This time you will find multiple erythema migrans. Not only multiple erythema migrans, apart from that you will also find facial nerve palsy. Facial nerve palsy and third degree AV block. These are the three basic manifestations which you find in case of early disseminated stage. There is final stage, that is late stage. So what do you basically find in this late stage, guys? You will find arthritis. Arthritis of what? Arthritis involving your knees, right? So this is the basic thing, and the diagnosis you do is by ELISA. And the treatment, what is the basic treatment which you give in these patients? You basically give doxycycline, you give ceftriaxone. Thank you so much, and this is the end of the lecture.